This Wharton professor has dug in and says, quote, "The numbers are not real. That much is obvious to anyone who understands how naturally occurring numbers work. The casualties are not overwhelmingly women and children, and the majority may be Hamas fighters." He, too, uses the Hamas-run Ministry of Health's reporting, only he uses the evidence to disprove what they're saying. For example, when Israel first went into Gaza in October, the Gaza Health Ministry released daily casualty figures. When he put those daily reports together, the total deaths by date increases in an unrealistically steady and consistent fashion. One would expect that in the fog of war, there would be at least some variation from day to day regarding casualties, but not when it comes to Gaza, according to the Palestinian Health Ministry. Look at that line, 0 dips, the death toll steady as clockwork, no matter how much more aggressive or not aggressive Israel is one day to the next. Here to explain is Professor Abraham Weiner, professor and the chair of the undergraduate program in statistics and data science for the University of Pennsylvania. Professor, thanks very much for coming on the program. Appreciate it. All right, so explain to me what led you to do this and bottom line, what your conclusions were.
So you've actually, in your introduction, made it quite clear what the issue is. So Gaza has, in its Ministry of Health, the Hamas Ministry of Health, has released numbers which obviously are really large. There's many, many people dying in a war, but in a war, people die. But according to Israel, at least, the vast number, its war, I should say, is being directed at Hamas, and therefore many of the people dying should be Hamas fighters. But according to the Ministry of Health, the majority, it's over 70% of the people dying are women and children, which leaves essentially no room for fighters or civilian non-fighting men to be part of the total. And so this has been promulgated all over the place almost since the very beginning. And as a result, we're just staring there looking at the numbers and saying this can't possibly be correct. So what I did is I dug into the numbers that were released on a daily basis for in late October through mid-November almost. And during this period of time, they were detailing the numbers of women and children and men and the totals. And I was tracking that, and it didn't look like naturally occurring numbers. And it looked like they were in some ways manipulated. And I don't know exactly how they did that, to confess. But they did it in a way that gives you the conclusion that what you're seeing is overwhelmingly women and children, but the numbers don't look right.
Tell me why they don't look right. I mean, be specific. How do you know that because they're saying 23 million are women and children, right, or so, out of the 32, 23,000. They might say million, but 23,000 out of the 32 are women and children. And again, be clear for us, how do you know, or why do you so strongly suspect that that number isn't true?
Okay, so there's a few things. So starting off with the fact that they already admit that there are thousands and thousands of fighters dying. So in mid-February, when there were only about 29,000 total dead, they had claimed that 6,000 were fighters. So if you add up the women and children plus the fighters, there's just no room for men who aren't fighters. And that already tells you that there's something wrong, just flat out, just from the start. And then, of course, we have the hospital that you described in your introduction that they claimed 500 had died, and that wasn't true either. And it not only was not true, but it was not even attributable to Israel. But the specific numbers that I looked at, and you have a graph there, just shows that on a daily basis for almost 2 weeks, the numbers of children dying, the numbers of total people dying, the number of adults dying was very, very steady. It created a very steady linear trend line with very little variation. There was some variation, and in your line, you don't really see that. But there is, in my original article, you can see some of that variation, but not enough. Not enough that you would see, given the fact that there should be enormous variation on a day-to-day basis because of the battle plans and what's going on actually in the war itself. But what you're seeing is very little variation in this period of time. Moreover, you're seeing very little, actually negative correlation or zero correlation in the number of children dying and the number of women dying. And that shouldn't be. If this was actually civilian casualties, when a bomb goes off in an apartment building, it kills women and children and the men who are around. And all that stuff should be highly correlated. On the days that there aren't very many dead, you should see fewer women and children, and on days when there are more, you'd see more. But all of that is uncorrelated and ultimately very little variation. And I don't know how that happens. I mean, that's not something I can say. But there are two problems here. You see this very little variation and the lack of correlation. And you also see the missing, what we call the missing men problem. And so one has to wonder, what are they doing to create this missing men problem? And there's a reason why they want to do this. And I think that's important, because it's important for people to understand that Hamas has really no path to victory in this war by military means. Their only path to victory is to get Israel to be stopped. And the way to do that is to convince the world that they're not actually fighting Hamas in a battle and war, but what they're really doing is a war crime by killing so many, or overwhelmingly, women and children, and not actually killing fighters. So that's why it becomes so controversial and so important.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your cable provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.